Hi everyone, it's Margaret Wallace Duffy, and we're here at the Still Waters Dental Group, my dentist, Dr. Corey Grossman, and we're excited today because we're talking about men's health. And in particular, right now we're here to discuss the connection between your oral health and your cardiovascular health. That's right, there is an absolute connection between the two. And here in this office, they're doing some cutting edge screening that's making a difference in the health and well-being of their patients. So Dr. Grossman, thanks for joining us on WOW TV.
Thanks for having me.
So now, last time I was into your clinic, there was this new technology that you were using. You actually took my blood pressure on my wrist. We've got my son Blake here today in the man cave because it's all about men's health. But I want to talk to you about why you're using this technology and why it's so important.
Measuring blood pressure is nothing new. The way this blood pressure cuff works, it's a UFit unit by Biosigns that what it does is it actually takes your blood pressure based on your pulse, not based on the corticoff sounds that it hears in the elbow. So in the dental office, it's a little more convenient for us to be able to take blood pressure based on a patient's wrist. You can imagine during the winter, a woman coming into the office wearing a sweater, it's hard to get her to take her sweater off just so that we can measure blood pressure. It's not the environment for that.
And in men, it's sometimes difficult, not all men, but to get them to the doctor. And so many men might not even know their blood pressure. And this is a quick and simple way, chairside, to measure their blood pressure.
What's interesting is the literature has come out that has suggested that patients are more likely to see their dentist more regularly than they are to see their medical doctor. So when was the last time you were at the medical doctor? Well, we have you at a minimum on a checkup twice a year. So you come in for a cleaning 2 times a year. So that's 2 times a year that we're at least going to be able to measure your blood pressure. Early detection for high blood pressure is the key to minimize symptoms. So if we can check it more regularly, then we can defer to the medical doctor to look at an issue if we find that the blood pressure is excessively high or even if it's too low.
Right. So in a young man like Blake, you're going to take his blood pressure, which I'd like you to do now so we can see sort of how this works. And how is that having early detection? Tell me the link between periodontal disease and heart disease.
Sure, just let's get the scan started. I'm just going to get you to cross your hand across your chest just so that the unit itself is above his heart. And then we're going to start the scan. The benefit of this unit is that it's calibrating right now. If you go to say to a pharmacy and do the pharmacy unit, when was the last time that was calibrated? This is connecting directly to the Biosigns website, and that website is making sure that this cuff is up to specs before it does a scan. So what the links in the literature have suggested is that people who have periodontal disease have a higher incidence of having heart disease. So periodontal disease might be more of a marker of someone's suggestive risk of having heart disease. High blood pressure as well is a symptom of atherosclerosis, something that we want to try to minimize the effect of.
Now, of course, with family history as well, and of course you're going to take family history when you see your patients, so the combination of family history and having devices like this for early detection can really make a difference in the health and well-being overall of your patients.
Yes, definitely. Heart disease, periodontal disease, there's a lot of links there. Genetics, gender, males are more prone to high blood pressure than, say, females. Diet is a big factor. If you're diabetic, that's another factor. Smoking also plays a role in all of these things. So somebody who has all these X's against their name are more susceptible to having heart disease, more susceptible to having periodontal disease.
Right.
Right now the scan's finished. What this does is it takes multiple readings of the blood pressure. And not only does it give us what the blood pressure is, in Blake's case, his blood pressure is 95 plus or minus 4 over 60 plus or minus 2. It gives us a confidence interval. So I would suggest that Blake is half asleep. I would suggest that his blood pressure is on the low side of what the accepted norm is. So we're always happier with low blood pressure than high blood pressure. The problem with low blood pressure, though, is that if somebody is too low, if they're having fainting episodes, dizzy spells, that's something that we really want to get checked out.
So it's, here, as always, getting phenomenal dental care, whether it's getting a mouth guard done, getting your teeth cleaned, seeing the hygienist. What I love about what you're doing, Corey, here in our community is you're also taking preventative measures to take care of the whole patient.
It's not the standard of practice to measure blood pressure on every visit. However, it's the standard of practice in this office that we just want to keep on top of it, and the more preventative we can be, the better care that we're providing our patients.
Well, you give me great care, my entire family great care. Thanks for joining us. I hope you'll join us again on WOW TV.
Look forward to it.
Now make sure you stay tuned here in the Man Cave today, because we've got more great tips coming your way to stay healthy for all the men in your life.